PREAMBLE is a multi-center international observational registry in which we collect data about relapsed refractory multiple myeloma. And it is particularly interesting the sub-analysis that we have presented here at THA 2024 about lenalidomide refractory patients. We know that the revolution in multiple myeloma is ongoing. There are many new drugs, many new combinations. However, for patients who have become lenalidomide refractory, we know that the outcome is not so brilliant. Particularly, we know that lenalidomide is the standard of care in maintenance treatment and is in some way the backbone of standard of care of a transplant-ineligible frontline treatment. So we have currently potentially in second line unmet medical need to cover. And in preamble sub-analysis, we have seen that for these patients, the overall response rate is only 31%. Independently from the drugs and combination that we use. And this means that we have to optimize the drugs and combination that we have available in this setting, such as, for example, belantamab bortezomib dexamethasone that we have seen to show incredible result in DREAM7 study, or selinexor bortezomib dexamethasone according to Boston study, because I think that we should find a new potential standard of care in these patients in which we could, in some way, we should achieve the same result that we are going to see in other settings. Next step is to increase the population for this registry. We are going to have more than thousands of patients, and I think that this analysis we covered about 1,000, more than 1,000 of patients. The next steps will be to have another research questions on this study, to be capillary in understanding how today we could cover the unmet medical need in multiple myeloma, because I think that even if the revolution is going everywhere, we have some settings in which we could do more, and this is the real end point of preamble. Moreover, we could understand how much the new cellular therapies, specific CAR-T, and also the cell modes could in some way change the present outcome for these patients, and in particular for relapsed refractory population. I think that analyzing the real-world population can give us some information that we cannot achieve in the same way from clinical trials.